Hello and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are preparing for our Gold Online Midwifery Conference of 2021. And I am so excited. I have one of our speakers here with us today and who will be presenting at the conference. And this is Dr. Karen Lawford. Welcome, Karen.
Welcome. Thank you. I'm so happy to be here.
Oh, it is lovely to have you here today. Thank you for taking time out of your busy day speaking with us here. So, Karen, tell us a little bit about yourself. First of all, where in the world are you located?
Right now, I'm north of Kingston, Ontario, in Canada. In a
That's
little, sorry, I'm babbling. That was terrible.
no, it's
Um,
good.
I live in the country, just north of Kingston, and I'm just on the water, and it's a really beautiful day today. Winter solstice.
Winter solstice is today. Beautiful. That's absolutely wonderful. Tell us a little bit about your background. I am so fascinated. I've read up on you. You are the very first midwife, Indigenous midwife as well, who has a PhD, who has a doctorate degree. Tell us a little bit about that.
Yes, so I did my PhD at the University of Ottawa and examined people's experiences of evacuation for birth in the province of Manitoba for those who lived on reserve. One of the things I do want to clarify, though, is there are a few midwives, registered midwives in Canada that work within a clinical setting and teach midwifery. As far as I know, I'm the only Indigenous midwife with a PhD, and I also am one of the very few midwives teaches outside of a clinical setting. So it is a little, I'm trying to figure out where I fit, and I think universities are also trying to figure out where I fit in their programming.
Absolutely wonderful. So you're a midwife, and we had a little chat before this little interview that we're doing here. You were showing us some pictures there. They are part of your presentation. One of the pictures was about your grandmother in there, and she was also a midwife. So tell us a little bit about that.
Thank you. So my grandmother, my kukum, she was a midwife to community members in her very isolated community, just in Northern Ontario in Treaty 3 area. And so my family, most of my aunts and my mother, for example, they were all born in the bush. I don't know if it was just with her, with other community members as helpers to the birth, but remembering that the practice of helping people give birth is not new. This is something that has been in existence since we have been, maybe you believe in creation story, since we were brought here by a creator, or whether we evolved, we still know that we had helpers during this really transitional time in our lives, because if we didn't, we wouldn't be here as human beings, because there were medical emergencies or emergencies during labor and birth that if we didn't have a helper, we wouldn't be here today. So yes, my kukum, my grandmother, was a midwife. I don't consider myself a midwife in the way that she was, but I am honored to carry on a practice, like deeply, deeply honored to carry on a practice that she had as well. And I believe in our conversation earlier, Kristen, that I was mentioning her wonderful, glorious hands and how beautiful and strong they were. I have smaller hands, but my hands are also very strong and quite dexterous. And I'm so happy that my daughter has also those hands.
Beautiful. Sounds wonderful there as well. When you were with your grandmother, did you learn midwifery also from her? Did you, or whether something you were doing together, talking together, experiencing together?
No, actually, I didn't. That's something I think that wasn't really talked about for fear of being criminalized, because midwifery, and in particular Indigenous midwives and care providers, that was illegal because of the Indian Act. And so she could have been put in jail, her children taken away from her. So no, this is not something that we talked about for the sake of survival, survival of colonialism and of white supremacy. So there are things, though, that she did teach me, such as beadwork, which is a very dexterous practice. She did teach me how to skin and fillet fish, how to dress a dead animal like caribou or moose. So those are the kinds of things that I learned from her, which actually are quite related to the technical skills of midwifery.
Beautiful that you were able to share these skills with her, but I can only imagine how difficult it must have been also not being able to talk about certain things because they were criminalized and
Mm.
forbidden.
Yeah.
Um,
Always having to be careful of what you say. That must be very difficult for people. And I know that there are um, things in place in Canada and perhaps around the world that do protect Indigenous care providers, such as midwives. But I do know there's constant criminalization of indigeneity.
mhm. Well, you play a big role of not only bringing awareness, but also protecting midwifery, Indigenous midwifery, because you are a founding member of the National Aboriginal Council of Midwives. Can you talk about that a little bit?
Yes, so when my daughter is 18, so about 18 years ago, we met as a group of midwives. I was a student midwife at the time, and we met in Six Nations, and we were surprised. I was surprised that there were so many other people learning to be a midwife or who were Indigenous midwives. And from there, it took many years. So even though that was 18 years ago, the National Aboriginal Council of Midwives formed technically a few years later. But I think it's really important that this is happening and that Indigenous midwifery is supported, not just in Canada, but globally, because
Hmm.
it is about a restoration, about a re-beginning of our ways of knowing, because they actually can help benefit the world. So I
Yeah.
think this idea that Indigenous knowledge is something of the past is quite a colonial, a source of disinformation, when in fact we're certain that Indigenous knowledges are still applicable today, and not just our knowledges, but our technologies.
Absolutely. I do believe that there is so much to learn from, Indigenous ways that the whole world can benefit from. And
Mhm.
for that purpose, I'm looking forward to your presentation here that you will have with us during the Midwifery Conference. And the title of the presentation is Indigenous Midwifery in Canada, a primer for improving health and well-being. Talk a little bit about that.
Thank you for inviting me, Kristen. I want to give an overview in the 60 minutes to the delegates, to the attendees, so that they can have another perspective of Indigenous midwifery in Canada. I am certain that the information I share will be transferable to their own countries, which have almost all experienced some type of colonization by some type of imperialism that is global in its expanse. So this is a specific conversation, but I do think there's a lot of like understandability, that's not a word, but the translating into their own context. For example, I know that there will be Australian delegates attending, and I look forward to how they critique and question their inclusion or not of the Indigenous midwives in Australia. Certainly, I've seen that in New Zealand, where Maori midwives are marginalized within the healthcare system, despite being there well before any colonizing force, the British, came. So the ways this benefits all of us, including diverse perspectives, we need to expand our knowledge. So if we're an evidence-based profession, we need to include all the evidence, not just the Western evidence, the Western way of knowing, a colonial way of knowing. Indigenous knowledges bring something to the table and are valuable.
I love what you just said. We need to include all the evidence-based information, not just the westernized, not that what but everything. That is so powerful.
Thank you.
Well, thank you so much, Dr. Karen Lawford. It was so wonderful talking with you here, and I'm looking forward to your presentation here, the Indigenous Midwifery in Canada, a primer for improving health and well-being. Thank you so much.
Thank you, Kristen.
And to our viewers here, this presentation will be live on February 9th of 2021. To find out more about this presentation and the other presentations in this conference and when they are live in your time zone, please visit goldmidwifery.com. Thank you everyone for watching. Bye-bye for now.